first thing we're going to do is do a blood test, which will pop you up on the couch and take your blood. So what we're looking for here is a whole range of tests. We'll take blood and put it in a number of different tubes, and we're going to test for your full blood count. We're going to test your kidney function, your liver function, your thyroid function. You're going to do a sugar test, a whole range of basically medical tests. And what injuries have you had? And,
well, a few years ago I had a slight problem with the ligaments in my ankle.
Okay. Which ankle do you remember?
It was my right ankle.
That's fine, cruciates are fine. So really what we're doing here is just checking your neurological system, the nerves and hamstrings, which are the curse of all footballers. Just relax, just breathe normally, okay? Okay, let's just have a feel any tenderness. All right, so that's the sort of end of the, what we call the history and examination part of the medical. And now we'll get the cardiac side of it, the heart side of it going.
From this piece of paper with these black lines and the shape of these black lines in different leads, we can actually see into the heart. We can see whether you have any problems with the heart. You can see whether there is a problem with your heart being at risk of you suffering a cardiac arrest, which is one of the things we really want to see here, whether there is an inherited problem in your heart as a problem. We can't see that on this ECG, which you'd be glad to hear. So that's all the things that we've seen from the ECG. It all looks normal.
Okay, that's good news.
Can you pop the lights down, please? Okay, cold gel in the chest.
This is the main pumping chamber of your heart, the left ventricle, and this is the heart pumping very well. We also can look at the other chambers of the heart. So we've got the left ventricle, the right ventricle, the left atrium and the right atrium, and we're also looking at the valves of the heart, little doorways within the heart, looking at the mitral valve here, and we can put what we call colour Doppler on. We can actually see movement of blood going through the heart. We also look to see if there's any leaking of the valves, and in this case, you'll be glad to hear that there isn't a leak.
For me, personally, probably the most nerve-wracking bit, because I've never had any sort of other serious medical problems or injuries or anything like that. So, you know, this is the one thing where something might come up that you'd never know.
An MRI stands for magnetic resonance imaging, and basically what we put part of Kieran's body into a big magnetic field, and it shows up beautiful pictures of what we call the soft tissue, so the muscles and ligaments, as well as the bones, and it gives us a very good indication of what's going on inside the different joints.
We can see there's this small area here which looks bright, and this is because there's a little bit of fissuring of the cartilage, some little clefts in the cartilage, and again that's probably because you've had an old injury at that point. The menisci, which are like the cartilage shock absorbers of the knee, look good. They should be a black signal like this, and there are no tears there, there's no degeneration. These are the cruciate ligaments, which are very important stabilizers of the knee, and those are normal. We also take a close look at the hamstring tendon origins. Again, hamstring injury is very common in football, and yours look good, normal. This is the end of the spinal cord, pretty clean looking spine, so not too many problems at all.
The blood tests, I've just got the results of the blood tests back, and they're all basically within normal limits. In particular, the diabetes test is okay. Your heart tests, as Dr. Somaru told you, were both okay. Your ECG and your echocardiography ultrasound of the heart, both quite normal. So really, in summary, I mean, apart from a few minor abnormalities, I don't think we've ever had anyone who's had not had anything to find on anything. I mean, I think really you're in pretty good shape, and we would certainly be saying to club management that there be no medical reason why you shouldn't be signed.